Hi, this is Dr. Jenny Byrne. I wanted to make a quick video today on a topic I hear frequently, which is about mental health and people who are in executive positions. So, especially in the C suite, which is CEO, um, chief operating officer, chief medical officer. These are all kind of common executive roles. And what I hear is that there's often a lot of talk about mental health for employees, but there's very little talk about personal mental health. And I get questions a lot about why that might be. Um, I think the stigma around mental health is very real. It is definitely improving, but it is something that most leaders hesitate to share. And I think it's extraordinarily vulnerable and powerful when a leader can share things that they have struggled with too. So, while recognizing that the stigma is real and you don't want to be labeled as somebody who cannot do their job, it is also a stigma and a misperception that people with mental health difficulties cannot be extraordinarily successful at their jobs. So that's kind of where I think the disconnect comes in. So if you're a CEO and maybe or C-suite or a leader and you're struggling with mental health issues, how do you deal with it? Like, what's a practical solution to this problem? So I think this is where the power of telling stories can come in very handy, because you can tell a story about something and tell the story in such a way that it resonates with the listener, and it shows that actually, despite your challenges, you were able to do well. um, the more vulnerable you can share your stories, the more safe your team will feel. So, an example of this would be, let's say you're an executive who has struggled with, um, I don't know, alcohol use disorder in the past, and you've had a problem where you were seriously drinking and having trouble, and it's currently not a big issue for you. Should you share that? Most people would say no, because it's very stigmatized. But I think you can tell stories and find opportunities to be vulnerable. So, for example, maybe your team is talking about, let's say it was during the pandemic, and people were talking about challenges of work life balance or people working at home and some of the challenge. You could tell a story from your past experience about a challenging time you went through and how sometimes alcohol was a way that you used to cope and why maybe that helped you at the time, and then maybe how it wasn't so helpful, and just to make it normal for people who are struggling. So you could tell a story about, hey, I was having this difficult time in my life, and it's a little embarrassing maybe to admit, but I actually used alcohol to help me cope. And in some ways it helped because I felt like I could escape from my troubles. But on the other hand, it wasn't so helpful because my body wasn't feeling that great. And I wasn't really engaging with the problem. I was just kind of avoiding it and kicking the can down the road. And so I found that even though it was a helpful escape, it wasn't really that productive or adaptive for me in the long term. So I don't know, maybe this is an example of a story. You can hear how I'm not just saying, hey, I'm an alcoholic, or hey, I had a drinking problem. It's really telling a story that's relevant in the moment to what is happening. And it's kind of vague enough that you don't go into all the details, perhaps, but you shared that you too struggled and that you used a coping skill that maybe was kind of counterproductive. I don't know. I'd be curious to get your thoughts. Um, have you ever seen anybody model this kind of behavior in a leadership position? And if so, how did it make you feel if you were working for that person? I'd be really curious to get your thoughts. Thanks for listening.